Behaviorism, implications in social work.
Behaviorism is founded on the concept that behavior is influenced by antecedent stimuli as well as consequences associated with the behavior, meaning that consequences related to a behavior will impact choices to either continue or discontinue the behavior in the future. Behavior followed by positive outcomes encourages the behavior to continue or increase. Conversely, negative outcomes encourage a decrease or a discontinuation of the behavior. It's important to know when thinking about behaviorism that it originally did not consider the influence of human thought or cognition on behavior and was based solely on what could be physically observed and not any mental processes. The introduction of thought as an influence on behavior came several years later and helped bridge together cognitive and behavioral practices into what we know today as cognitive behavioral therapy. And as we learned earlier in the semester from the Langer and Leitz text, CBT is relied upon as an evidence-based practice. For the purposes of this presentation, we'll focus only on behavioral principles. There are four main principles of behaviorism: classical conditioning, operant conditioning, reinforcers, and punishers. Classical conditioning explains that behaviors can develop based on associations between stimuli. So for example, when I was a child, I ate spaghetti for dinner one night, and I woke up sick the next morning because I had the flu. But for a long time after that, I refused to eat spaghetti for dinner because I associated spaghetti with being sick. In this scenario, the associated stimuli are the spaghetti and the flu, and the observable changed behavior is my rejection of eating spaghetti for dinner because of the association that was developed. Building on classical conditioning is operant conditioning, which explains how behavior is influenced by the consequences that follow behavior. These consequences may encourage or discourage the behavior. There are two types of consequences: reinforcers and punishers. Reinforcers are stimuli that encourage the increase of behavior. They are positive or negative by either adding a desirable stimuli or removing something undesirable. So as an example, let's say a child has a messy room, and the behavior to change is the child's maintenance of the room. If the child cleans their room and they receive a reward of $5, this is a positive reinforcer. Another potential outcome of the child cleaning their room would be that their parent stops yelling at them or stops nagging at them to clean their room. This is a negative reinforcer in the sense that it removed a negative stimuli, the negative stimuli being the yelling and nagging from a parent. Punishers seek to discourage or decrease behavior through negative consequences. So for example, turning in late assignments is a behavior, and a consequence of that behavior is a reduction in points on that assignment.
Behaviorism has many strengths. One strength is that the data is collected through observation. It is very easy to collect data since the participants are being observed in their current state. Another is that it can be applied to all age groups and settings, and the concepts of behaviorism are well defined and easy to understand. Therefore, they are easy to teach in professional settings. A third strength is that it has effective therapeutic techniques. Effective therapeutic techniques can be very useful in changing harmful behaviors in both children and adults. Some examples of therapeutic techniques for behaviorism include intensive behavioral intervention or behavior analysis. One last strength is positive results increase the chances of a behavior happening again. When people engage in a behavior that gives a positive result, they are more likely to continue doing this behavior. There are also limitations of behaviorism. One limitation is that behaviorism ignores the mental processes. It ignores the mental processes that are involved in learning. Behaviorism focuses on how people can only learn as a result of their experiences. A second limitation is that it does not account for internal influences such as moods, feelings, and thoughts that the person is experiencing. Another is that it focuses on changing a behavior, and it also focuses around the environment. This means it focuses on the effects the environment is having on a person. It disregards genetics as a reason for the behavior. A third limitation is that many behaviorism theories come from being tested on animals. This makes it hard for the same theories to be applied to humans because humans are more complex than animals. Lastly, it can interfere with a client's right to self-determination. Practice with behaviorism began with the mentality that the professional was the expert, and this conflicts with social work concepts of treating the client as the expert. Therefore, this framework can put the social worker in an authoritative position and not a collaborative position, which can interfere with the client's self-determination.
Practice settings. Behaviorism, as previously discussed, discusses how our actions are affected by what happens before a behavior and the consequences that follow. As social workers, we can continue to work with individuals in many different practice settings. Social workers can work with clients who are hospitalized, within schools as a support for children, in their own office, and many more settings. At times, a social worker can work with clients in their own home, providing any skill building as well as implementing programs such as Head Start. Group home settings are also a setting that is significant for individuals who are placed within a group home for psychiatric reasons. Treatment can occur within residential crisis homes, temporary settings, or even parenting groups with multiple individuals. Social workers, of course, will continue to individualize services based upon the client's needs. Diverse client systems. Behaviorism contains a basis of social learning theory. It is important that we continue to understand that each culture contains its own beliefs and values. As social workers, we must make ourselves aware of the client's culture that we are working with. Many cultures do not share the same beliefs, therefore, social learning may exist in different forms for each individual. In order to recognize the different cultural aspects of the client that we serve, we must be aware of the verbal and nonverbal cues and behaviors that exist within the culture we serve. One behavior in our culture may be significantly different than the other cultures that we become exposed to. Behaviorism can be utilized in many different settings. This also means that behaviorism can be utilized in multiple different age groups. While this is true, it is important for social workers to understand the culture and behavior of each age group. For example, when working in diverse systems that are religious, we must continue to understand the practice of the religion to really be able to effectively treat the individual. We must make ourselves aware of the surroundings that we are providing treatment in order to respect those around us. Because cultural differences will affect our work with groups and individuals, it is important to continue developing our cultural awareness skills. In addition to training and experience, clinicians can cultivate an awareness of diversity and honor what is right for the client. Making culturally informed assessments may lead to culturally informed interventions. Some tips that may help clinicians working with diverse client groups include: use culturally appropriate language and avoid clinical jargon, understanding your own cultural biases, advocating for diversity in the workplace, and avoid making generalizations about clients based on the culture they represent.